My name is Sheila, and this is another yoga routine for just after having abdominal surgery. And again, in this one, it's very gentle. We won't be doing anything that stretches or engages the abdomen. So in many cases, it can be done right away as soon as you're able to get up and walk around and move around. This routine should be fine, but please do consult with your doctor first and get the okay. So all we'll need today is a chair or a stool, and also if you have a scarf or a hand towel or a yoga strap, you want to have that nearby as well. So we'll go ahead and get started. You can have a seat in your chair, and if it's more comfortable, you can put a pillow to have your thighs so that they're parallel with the floor, depending on your height and the height of your chair. And we'll go ahead and just start with some breathing with shoulder work. So you'll inhale, shrug your shoulders up towards your ear. And exhale through pursed lips as your shoulders come down. Inhale through the nose, lifting your shoulders up to your ears. Exhale. Once more, inhale. And exhale. And the breath should be gentle. We're not in this routine focusing on deep belly breathing. So you don't want to focus on the diaphragm drawing down with the inhale into the belly space to keep your surgical area safe. We're focusing on the other parts of the rib cage, just gentle breathing, nothing vigorous. And now we'll take that into some shoulder circles. Just nice big shoulder circles going in one direction and the other direction. And then we'll make those rotations a little bigger. So bring your hands to your shoulders and make chicken wing shoulder rotations going in one direction. This is great to get the lymph flowing, get the circulation going. And then the other direction, help move out any gases that got pent up with the surgery. And then bring the arms back to the sides. And next we'll do some neck work. So you can make some big neck rotations going in one direction. And the other direction. To the center. And then we'll go ahead and clasp hands behind your head and bring your chin to your chest. Just applying a little gentle pressure with your hands to stretch the back of the neck. You can move your head side to side a little bit to stretch the sides of the back of the neck, if that feels good. And bring your head back up. And then if it feels good, without stretching your abdomen, you can latch onto the back of the chair with your hands so that you just get a little stretch through the chest. The heads of the shoulders draw back and lift the sternum up towards the ceiling. So again, the stretch is only through the chest and through the spine. And then as you do that, you can also lift your chin up, reaching your chin up towards the ceiling. And if it feels good, you can move your chin side to side a little bit. And then back to neutral. Then next, bring your right ear to right shoulder. You can either stay like this, or if you'd like, you can take your hand and apply a little pressure. Breathe into the side of the neck. And then bring your head back up to center. And bring your other ear to other shoulder. And if you'd like, you can bring your hand to your opposite ear and apply a little gentle pressure. Bring your head back to center. Bring your arm back along your sides. And then next, make some wrist rotations. You can rotate the other way. And we'll turn so that you're sitting at the corner of the chair, if that's comfortable, or stool. Bring your hands, this is a little hip stretch, you'll bring your hands to the hip creases and just do a little side to side. So one hip will open out to the side, and again, you don't want the abdomen to be stretching, so it's just gentle movement in the hip creases. And then knees back to center, and open the knees the other way. So the one hip will be internally rotating and the other externally rotating. Back to neutral. And we'll go to the other side. And you've got internal, external rotation. Back to neutral. Other side. Back to neutral. Other side. And we'll just go side to side. You're using your hands to really help move the thigh bone in the hip socket, in the ball and socket joint. Just gentle movements. And if you want, you can add the breath. So you'll inhale, center. Exhale, one side through pursed lips. Inhale through the nose, back to the center. Exhale, other side through pursed lips. Gentle inhale. Exhale, other side. Inhale, center. Exhale, other side. Inhale, center. Exhale, other side. And then inhale, center. Stay there. And we'll come back to the center. And we'll get a little bit of so if you have your scarf or strap. Just be very careful when you bend to get it. And you can go ahead and just drop it to the floor and stick your foot in the scarf or strap. And at first, you can just, it may be enough just to use this scarf or strap to help flex the foot, and then point the foot to resist the scarf or strap. So exhale, flex, inhale, point, exhale, flex, inhale, point. And then you can either stay here, or if it's comfortable, using your arms, not your abdominal muscles, just lift the leg a little bit. So get a little hamstring stretch so your foot's flexed. And you can make little lifts and lowers, or just hold it stable. And then lower. Now, straighten the other leg, and we'll use the scarf or strap to bring the leg the first leg into external rotation. So it could be that you feel a hip stretch here, and that's enough. Or if you're used to doing yoga and your hips are a little more flexible, you might be able to bring your leg up a little higher above the knee, in which case, if it's above the knee, you can bend the other leg. But wherever you are, the most important thing is that it's gentle, and that you're getting just a gentle stretch through the hip, nothing more than that. And so we'll find a nice place, and as you inhale, focus on sitting up a little taller, as though there's a string tied to the top of your head, lifting you up. And then exhale through pursed lips. Inhale, nose. Exhale. One more breath. Inhale. And exhale. Now we'll bring the leg, using the arm to help bring the leg back, and release the strap or scarf. And we'll switch legs. So you can step on the scarf or strap, straighten your leg, and inhale, point the toes. Exhale, you use the scarf or strap to stretch the foot. Inhale, point. Exhale, flex. Inhale, point. And exhale, flex. And now just a gentle lift using your arm strength, not your abdominal muscles. And just stretch the hamstrings, keeping the foot. And if your foot is still at the floor, that for some people that might be a hamstring stretch. That's plenty. So just gauge where you feel the best stretch, and it's just a very gentle, mild stretch. One more deep breath. Letting the breath relax the mind. And slowly lower the leg back to the floor and straighten your other leg, and we'll do the hip opener so you can gauge where you feel that light stretch, whether it's at your shin or up a little higher or with the bent knee. And just stay there. And With the breath, you'll inhale, lengthening the crown of your head up towards the ceiling, and exhale as though through a straw. Inhale. You can even close your eyes. Exhale. And inhale. And exhale. And use your arms. Use the scarf or strap to support your leg back to the floor. And you can set that aside. Bring your legs back to neutral. And we'll just finish with a little bit of alternate nostril breathing, which is really good at stimulating the vagus nerve and helping with the rest and repair from the surgery with healing. So you'll close off your right nostril. Exhale through the left nostril. Inhale, left side. Exhale, right. Inhale, right. Exhale, opposite. You can keep going at your own pace. And if you like, you can visualize the breath as light. So as it passes along one side of the spine, imagine the breath is light going along that side of the spine, up through the brain, crossing over through the hemispheres, and then down the other side with the exhale. We'll do a couple more rounds. If you like, you can create a little pause there at the top and the center of the brain. And just imagine there at the top of the inhale, the center of the brain expanding and relaxing. And down the other side. And then finish with your next exhale on the left side. Take a deep breath out of both sides. And alternate nostril breathing can also help with pain relief if you're experiencing any sense of pain or discomfort. Has so many benefits, and it can be done for any length of time, but they say for maximum benefit it's helpful to do it for at least 5 minutes. So it's a great thing to do several times a day post-operation. And I hope you're feeling relaxed and that you got some circulation going, and that you have speedy healing. Namaste.